And let's get you the very latest then on the cough syrup deaths. The death toll in Madhya Pradesh now has reached 20. 20 innocent children have been poisoned because of a cough syrup that was prescribed to them. The Indian Medical Association has now written to the health minister, condemned the arrest of the doctor in Madhya Pradesh. Remember, the doctor has been arrested, but no action has been taken against the various drug regulatory agencies or indeed the pharma firm. And the Telangana Drugs Control Administration has just banned 2 syrups, Relife and Recipe Fresh. Will the pharma companies be held accountable, or will the doctors only be the scapegoat? Is the question I want to raise. Dr. Dilip Bhanushali, President, Indian Medical Association, joining me. Dr. Viranchi Shah is National Spokesperson, Indian Drug Manufacturing Association. Appreciate both of you joining us. Dr. Bhanushali, how is the Indian Medical Association seeing this? Do you believe doctors are the scapegoat and the pharma companies are getting away?
You have rightly said, doctor has become the scapegoat. If you remember, a terrorist has been given an appointment with opening of Supreme Court night 2 o'clock for a bail. And our doctor has failed to get a bail today. Why? Because you know what is the reason behind it. He has become the scapegoat.
Yeah, so
in what way?
What is the reason? You tell us. You're saying that why have the doctors been made a scapegoat? Tell us why you believe doctors have been made the scapegoat.
You tell me, why is the hospital responsible for the adulteration of the drug? Adulteration of that medicine. In what way doctor is concerned? So the manufacturer, the drug controller...
So who should be arrested according to you?
The drug controllers, the manufacturers, suppliers. Right, doctor? The first thing they did was at night 2 o'clock, they arrested the doctor. And what did the government do? The government suspended...
I want to bring in Dr. Viranchi. I want to bring in Dr. Viranchi Shah. Dr. Shah, you want to tell us, according to the Indian Medical Association, the pharmaceutical company based in Tamil Nadu must pay the penalty. So should the drug controller in Tamil Nadu, and indeed those at the center who allowed these drugs to be prescribed. Do you believe that the drug manufacturers have much to answer for?
So, Radip, thank you for having IDMA on this discussion. This is a very serious discussion where we have lost a number of lives, and every life is important, and we all understand the gravity of this situation. But unless we come to a conclusion on the investigation that is going on, which means that there is an investigation going on the drug companies, there are investigation going on with the doctors, what kind of prescriptions were given, whether it was given a right dose or not. There are so many questions unanswered as we speak today. And unless we get the answers to this question, I don't think it would be right to say whether in general, whether the drug companies are at fault or the doctors are at fault or both are at fault. It could be anything. So I think we have some experts who are already looking into it.
1 minute. Yes. Yeah, there is no proof. No, 1 minute, sir. No, 1 minute. There is no... If the evidence at the moment prima facie is pointing towards drug adulteration taking place at the level of the manufacturer, at the moment prima facie is what it is suggested in the case of cough syrup. The point the doctors are making is, why is the doctor being held responsible? Are the pharma companies getting away? You know, the pharma companies are way too powerful compared to some doctor in Chhindwara.
Sir, this is not you versus me here. So I'm not here to say whether the doctor is wrong or we are right or the other way around. My point is very simple. We should wait for a proper investigation. Right. This is a very serious issue. And unless we have all the facts of the biopsies, autopsies, the post-mortem, the drug sample analysis, everything is there, it would be too early to say who was wrong. Now, coming to your question on specifically on the quality of a specific product coming from Tamil Nadu, it looks prima facie, as you said, that the cough syrup was indeed contaminated with diethylene glycol or ethylene glycol above the permissible limits. We don't know as yet if that was the cause of death, but even if it is so, and it is above the limits, as per the Drug Act, the manufacturer is liable for penal action, and it happens. So for an adulteration, the minimum amount of penalty is 7 years of rigorous imprisonment as per the Drug and Cosmetics Act. And there are enough safeguards in the Drug Act to get hold of such people if they have made mistakes. But again, as I said, we should wait, specifically when we say that there are deaths of so many children, for a proper scientific investigation. And we have to all work together rather than whether A is against B or B is against C, to ensure that when we say that India is the pharmacy of the world, Radip, and we supply essential medicines to almost 200 countries. US is our largest customer, for example. Most mature markets do import essential drugs from India. So it's not that we don't have the capabilities, but we have to understand, even if this happens, what are the gaps? And I'm sure the highest offices in India are working along with the industry, with the trade, with the doctors, and we should try to find out the
Sir,
real culprits and
sir,
try to
with due
block it.
regard, sir, with due regard, Dr. Shah, no one is labeling all drug manufacturers in India with the same brush. But we exposed yesterday the kind of plant in which this drug was being manufactured in Tamil Nadu in the most unhygienic conditions. That's my point. And the fact is, this was not going on for the last few months. It's been going on for years. And yesterday I had a leading expert on drug regulation who's saying that this is not some isolated case. Therefore, there is a serious problem with particularly small firms which are cost cutting and thereby putting drugs and the lives of people at risk with low quality, low cost drugs.
I absolutely agree. I'm not defending the manufacturer. I'm not saying that what they have done is because of this reason or that. If that is the case, then I am sure it has already been shut down. And you must be aware that India has already upgraded its GMP requirements, which we know popularly as the Schedule M. It is going to be in effect from the first. For most of the companies who are in the large and medium segment, it is already in effect today. For the small companies, because we had to give them more time and more resources to cope up, it is going to be in effect from the 1st of January, which is the revised Schedule M. So a lot of steps have already been taken preactively. And if there are gaps, I'm 100% sure that IDMA, Industry Association, regulators and government all work to ensure that if there are these gaps, we have to plug them up. I'm not defending them. What I'm trying to only point out is that we should